not necessarily show it, but in fact show my respect by being prepared. If that's the case, when Tim Murphy comes here, I think we try to out-prep each other. He knows I'm going to be prepared because I'm interested in what he's doing. On the other hand, he comes in with a 3-ring binder and he's got his iPad and he's ready to do business. So it's always a privilege and pleasure, sir.
It's good to see you, too. We should have called each other and checked out our wardrobe. Yellow tie.
You always wear white.
I know, and so I thought I'm going to be a little bit different today. I'm going to be colorful. The end of summer, and here we are, the Bobbsey twins.
We're going to have our people talk to each other.
Yeah, let's have our people talk.
Let me ask you something before we get into the House Bill 2646, the mental health reform bill that you have going. I want to talk. You're out of session right now. It is, as we are all learning every single day and have for some time. It's an outsider's general election. You have been there for a period of time, and yet you're very, very popular on the outside here. How does that work?
It takes a lot of work to do that on multiple levels. One, high visibility. I try and get to every event I hear about, because I find whether it's a church picnic or a county fair or a small neighborhood gathering or just kind of going to the Giant Eagle or getting gas at a gas station, engaging conversations. People like to know that you care about what is on their mind, and in that context, the exchange of information I get is really valuable. The second thing is engaging with them on a regular basis with my weekly email news, with mailings. The staff are very involved in the community. And then working on legislation that means something to people and let them know what that is. And so whether it's been the mental health legislation, working the military bases, working on local issues here, that's how you engage.
You know, I guess it's either a cynical point of view or it's the right point of view that a congressman is running for office all the time. And I say cynical in the sense that, that sort of implies that you're always worried about keeping your job. But you're not going to keep your job if you don't, in fact, have the context you described. So you can't become so consumed with that next time at the risk of doing what you have to do in the short term. Is that fair?
Well, any job. I mean, if someone works at an assembly line and they're not getting their work done that day, their job is on the line every day. And I look upon that. We're temp employees. We all are, ultimately. Your ratings are watched. The performance of what you do, and my ratings are the same thing. And so you always got to be on your best and work at it out. I make mistakes, and sometimes I'm not at the best of what I'm trying to do, but that's it. You have to always be focused and trying to do better, and that's what the people want to know, that you're engaged in things and you're not aloof and distant.
That's fair. All right, let's talk a little bit about what's been a long battle for you, personal and otherwise, as it relates to the Families in Mental Health Crisis Act. You've been kind enough to be here a few times to talk about it. And, of course, in July you had this wonderful victory of sorts. 422-2 was the overwhelming vote in favor of it at the House level. There had to be some adjustments, as I understand it. Talk a little bit about what took it from a bit of a 50-50, my words, not yours, to something as overwhelmingly positive as that vote.
Well, when we moved out of the subcommittee on health, it was not widely bipartisan. We had some Democrat support, but even though we had 207 co-sponsors, bipartisan co-sponsors, I think 55 or so Democrats in that. But we made some changes to it. One that all along I didn't think we could get was putting some money into it. There's $150 million in here for various grants for training programs for more psychiatrists, more psychologists, more peer support, more what's called assertive community treatment for people in the revolving door of jail and hospitals, more community support, cleaning up the grant system. There's a lot of things in there. The second was we had a long time snag on just what to do to handle what's called the HIPAA laws, the Health Insurance Portability and Privacy Act. And that was the part that really is, it's the abandoned existence of so many doctors when they think, I want to share information with a caring family member, but the person's not allowing me to. And in most cases, we can deal with that. You get the patient's permission. But when you're dealing with someone who is so intensely schizophrenic or bipolar or depressed that their mind is not even operating right because they're living in a world of delusions and hallucinations, and they're not giving permission to a family member to help them, that's our struggle. So we came up with language that works pretty well. We'll test it out. We also had some problems with costs, that I want there to be more psychiatric beds for when people are in crisis. That's like the intensive care unit when a person is having a schizophrenic or psychotic break. We don't have enough beds. We have a shortage of 100,000 beds, and that's because Medicaid just says we're not going to pay for it. So come up with some language that works there that doesn't give us a huge cost factor. And then we're just building that. I think what really happened here, there was a tipping point probably around January or so when Paul Ryan became Speaker of the House. His very first TV interview, he says, we're going to pass the Murphy mental health bill.
I remember that.
And more people were getting on board saying this is for real.
I may have emailed you, as a matter of fact, after that.
Kevin McCarthy, the majority leader at that point, says he's committed to move it on the floor. The majority whip, Steve Scalise, says, let's go. More people are coming on board. And I was going to members' districts, Democrats and Republicans. They invited me. We were holding town hall meetings on this. And this whole tipping point was reached where, as Kevin McCarthy said, the impossible became the inevitable. We knew we had to deal with this. And then when we finally had a vote of 422-2, and those two don't vote for anything, so I call it a unanimous vote, as it was, I was surprised by the results.
Let's talk a little bit about the least purpose. I mean, this was not an insignificant concession in some ways by you, because you recognized that you couldn't change the HIPAA and still be able to get the support of the Democrats, because their concern, as I understand it, was if you start to do that and mess with HIPAA, that in effect those that are ill might walk away or stay away and not come in for treatment. Whether that's true or not, I imagine, was some subject to debate. But you then put it into the Health and Human Services, and that language seemed to be the key.
Sure. What happened here was HHS Secretary and others were saying, oh, doctors can do this now. Even the AMA said, we don't think this is a problem. Then the lawyers came in and met with us and said, oh, actually, it is a problem. And so it came down to this. What we're trying to say is, look, people with severe mental illness, those 10 or 11 million Americans, and 40% of them are in no treatment at all. In many parts, about 40% don't think they have a problem. It's part of the medical condition. It's called anosognosia. They do not believe they have symptoms of this. Similarly, people with a stroke or Alzheimer's or dementia also are not aware of their illness. People with head injuries are not aware of that. So what happens is we recognize that 75% of people with severe mental illness and have at least one other chronic medical problem. 50% have at least two chronic medical problems. When that could be heart disease, lung disease, a metabolic problem, diabetes, an infectious disease. And what happens then is they are going untreated. Maybe they don't see a physician, they don't follow through on treatment, they don't recognize the symptoms, whatever that is. Those problems get worse. On the cost level alone, this is a staggering statistic. 5% of Medicaid users account for 55% of all Medicaid spending, and that is your seriously mentally ill population. It is staggering that that's where this money goes. The other part of this is that we know with treatment they can get better. We know when family members are engaged, the success rate of them getting better is a staggering, dramatic number. And many families want to be part of this, but they're banned from doing this. It has an old legacy in the belief that family members are to blame. When you look at things like depression and schizophrenia, etc., they usually blame family members. And so family members won't talk about it because the stigma is, oh, you must be bad parents. In fact, we use terms in the field called schizophrenogenic mother or refrigerator parent to somehow show the parent is cold and distant aloof and they're causing the problems. Now we know that's not true. Now we know there's lots of other reasons. So the point is, how do you have a doctor be able to say to a parent, your son has diabetes, he needs to follow up with an endocrinologist, he needs regular insulin tests, he needs to have these things, because the person themselves may not be doing it. And our point was, why can't we at least let the caring and loving family member be involved with that? Why can't the wife or husband or the brother or sister or the mother or father do this? And that's when HHS reached the point and says, well, we think we can work this out. Then we said, in the law, we said, you got 1 year to make it happen. You must come up with language that's acceptable so that we're not letting these people die. Because here's the final statistic on this. The death toll, annual death toll with mental illness, serious mental illness, is staggering. We know there's 43,000 suicides that occurred in the United States last year. There's 47,000 drug overdose deaths that occurred last year. There's about 1,000 homicides by someone who's mentally ill. There's about 250 to 300 encounters where a person with mental illness attacks a police officer with a gun or a knife or something, and they are killed in that process. But the biggest number are the mentally ill who die from chronic illness. When you add all those numbers together, it's a staggering 350,000 1,000 deaths last year in this country from that. And that's more than the combined U.S. combat deaths of World War I, Korea, Vietnam, Desert Storm, Afghanistan, Bosnia. I mean, name them all. Everything except World War II. Staggering numbers. So we have to deal with this.
Severe mental illness, and we're not talking about just being under the weather one day, not to totally minimize that, but his is, of course, a deeper concern. So we're going to come back, talk a little bit about why